معاكم النهاردة في حلقة جديدة مع بودكاست للسكر. أنا النهاردة في روما بحضر مؤتمر النيودياب اللي هو مؤتمر الجمعية الأوروبية لالتهاب الأعصاب السكري، ويسعدني إن أنا يبقى معايا صديقتي الأستاذ الدكتور ميترا تافاكولي من جامعة إكستر في إنجلترا. Hello, Mitra. Will you
Hello.
please introduce yourself?
My name is Dr. Mitra Tavakoli. I'm Associate Professor in Medicine at the University of Exeter in England.
Okay. And what would you like to tell us about today?
Any topic you like? What
Yes.
do you
How
want to
about
talk
I'd
about?
like you to talk about the dry eyes
Yes,
with diabetes
yes.
as a form of neuropathy.
Yes. Do you have many patients complaining of dry eye in your
I
clinic?
am complaining of dry
Yes.
eyes myself.
Okay. Dry,
Everyone, nearly
yes.
everyone I know has
Really?
dry eyes. Yes.
The dry eye is a very, very attractive topic at the moment, and there are lots of research is going globally for diagnostic and the treatment.
Okay.
And in fact, they call it dry eye syndrome because it's a combination of lots of factors and the risk factor, which makes it even much more complex than diabetes. Yeah. And lots of conditions can affect that. Our lifestyle, staying inside, the air conditioning, the hormonal changes, the sun, looking all of the screens and your mobile, all of them, and our diet, all of them are playing factors to increase the level of the dry eye globally.
Mm-hmm.
However, it's much more profound in patients with diabetes.
Yes.
The reason is because of the hormonal changes. Diabetic patients are much more prone to getting the dry eye.
Yes.
And it's important to distinguish the dry eye caused by diabetes or the dry eye caused by nerve damage.
Okay.
In diabetes, it's a mix of them. They have hormonal changes. They have some kind of, if they don't already have established neuropathy, they have a subclinical or background neuropathy, and those can cause the nerve damage, and that affects the cornea, that produces helping the tear keeps the integrity of the cornea, and those creating a much more worse case scenario for a person with diabetes to suffer from dry eye.
Yes, dry eyes. But is dry eyes the end of the road? Is there something further?
In general population, 60% of people have been shown that they have dry eye.
Okay.
And in diabetes, it goes over 80%.
So basically, you have 20% more than the general population.
Yes.
Okay.
But there is not all bad news. There is a treatment for the dry eye.
Wonderful.
But the treatment needs
It's
to
just
be
we're just putting
comprehensive
we're
treatment.
putting tear
That's
drops, tear creams,
yes.
tear ointment.
Yeah, that can be a part of that. But to assess what is the reason for the dry eye, it needs to be assessed looking at the tear layer that ophthalmologists can do and the cornea. And then you can look at also the other factors that play with diabetes, like the changes in the level of the blood sugar and the lipid profile and everything else.
So just stop here for a moment. So what you're telling me right now is if I have diabetes and my blood sugar is jumping up and down, this will cause dry eyes without anything else.
It can play an important factor to enhance the symptoms of dry eye.
High cholesterol, my high cholesterol can cause dry eyes?
Not directly, but it can be indirectly correlated. Therefore, if you look at the tear layer from the anatomic point of view, everyone thinks the tear is only just water, but the tear is made of 3 different layers. It has a lipid, it has protein, and it has a water. And the imbalance between the level of protein and the lipid usually is the most causes of the dry eye.
Okay.
The other thing is they call it the dry eye that caused because of the lids function.
Yes.
And that's another important factor in diabetes patients. Therefore, after assessing
the lid function, his eyes don't close.
Yes. And
like
over
facial
the night,
nerve pulsing,
yes, or even a slight changes in the lids and the.
Because this is new to me.
Yes.
Okay, so now basically what you're saying is if I'm diabetic, my eyes may not close properly
over the night. Yes.
Really?
Yes. And it can be a evaporative dry eye as well. That there is enough tear, but that goes away immediately. Okay. Therefore, after assessing and establishing that your patient has a dry eye, depends on the causes of the dry eye, we can do a different type of treatments. In the market, when the patient goes to a pharmacy, there is a huge number of eye drops, and they are quite expensive actually.
Yes, I
and
can
each of
tell you
them
this.
are saying that there are something for one. In the UK, there are lots of variety, but until the patient doesn't know which one is really related to his condition, is really just wasting the money.
So basically, what you're telling me is it's not just any
Drop.
substitute.
Yes, therefore, if
That's
you have a
it?
lipid deficiency, you need to use eye drop, which is more having the lipid part of that. If you have the protein or you have a meibomian gland, the glands around the lids are affected, you need, the focus should be opening those glands rather than putting more eye drops in the eye. And if it comes because of dehydration, drinking the water, or it can be because of the lack of omega-3 and vitamin E in the diet. Therefore, each of them has different cause and side effects. Therefore, at the first stage, usually in the clinic, the clinician recommend the combination of all of them.
Basically, what you're saying is a well-trained ophthalmologist can look into my eyes and tell me, you have a problem with not enough fat being secreted, or not enough protein being
or
secreted.
They can tell you have the glands are not functioning well.
He can say this by looking.
Yes.
Is
With
this
the microscope.
knowledge?
Yes, I believe so.
Microscope is the slit lamp, you mean?
Yes, the slit lamp, and then putting some fluorescein, you can see all of those glands that they are upscale.
Fluorescein is this orangey thing.
Yes,
they put
and there are lots of clinics now. They are running this service of dry eye clinic, and some of them are very expensive actually. Some clinics even have a device that they get some part of your tear, put it in the device, and the tear lab can give you exactly the level of all the different. The name of the device, one of them is tear lab. It gives you a name of all of the proteins. Yes.
Really, this is something that this is beyond my imagination.
Yeah, and actually the tear lab can go even further. We can more research in the neuropathy. With looking the tear, you can find all of the deficiency that can cause the neuropathy via the tears. Something like neuropathic biomarkers.
Really?
Yes.
It's very interesting.
Absolutely. And there are lots of now manufacturers in France, Germany, UK, and lots of them in India are developing new eye drops that can address those deficiencies. And therefore, in the future, which means that in the next couple of years, there will be a treatment that they can have like a stem cell deficiency treatment for dry eye.
That's very interesting.
And the neuropathic treatment as well.
See, like as a diabetologist, when I say diabetes on the eye, first thing I tend to think about is diabetic maculopathy, retinal neovascularization, retinal detachment, retinal bleeds, retinal tear, and that's it. I never infections maybe, but I never thought of the dry eyes as a problem of diabetes.
I've been actually in there are like meetings, dry eye symposium, 4 days, just latest research in the field of the dry eye, and you will be amazed with the level of in the exhibition area. As I say, it's a very, very rich industry.
Yes.
There were like over 20 manufacturers just for one small symposium, showcasing the latest products and the new things coming every month.
This is very interesting.
Yes, but the part of these stem cells and these neuropathic biomarkers is extremely exciting and important. And there are I think there are 2 centers in India actually. They are doing the most important research, and they are developing this new. Yes, but anyway, for general public, I would say a combination of having a heat therapy. Usually they say when you are in a steam room, like in the shower, stay there for 5 minutes, and then you can slowly massage the lower lid. It's a very subjective test. I don't know how much to massage really. Therefore, to overcome, there is something developed they call it eye bag. Inside of those eye bags, there are some flexi seeds and some other seeds. You put it in the microwave. The heat of microwave opens the oils that they are essential oils, and then you put it in your eye for 5 minutes, and the heat from that and the oil opens all of those glands. And if you do it in the first month 2 times a week, and then after that 1 time a week, you wouldn't have any gland
This is
problem, which
very
is
interesting.
very important, but that can lead to Sjogren syndrome as well, which is because of the meibomian gland dysfunction.
Sugar?
Sjogren. They call it SJ, is a German word.
Jogren?
Maybe you pronounce it Sjogren?
Jogren.
Yes, Sjogren is
Jogren.
in the
Say it.
German, yes.
Okay, yes. This is a disease where you totally lose all hearing capabilities.
Not all, but it can also, that loss of, that dry eye can lead to a very significant nerve damage in the cornea.
This is very interesting. But for me,
Yes.
this is all news. Like this is all
Yes.
new for me, even though I'm supposed to be
Yes.
a well updated healthcare
Yes.
professional. But actually, this is
Yes.
quite a thing. Like we have absolutely no clue what our friends at doing liver disease, for example, are doing.
Yes.
It tends that everyone goes their way, and
Yes.
we're not doing it all together.
Absolutely, yeah. And then the other thing is that is very, very important is to take more omega-3 vitamin E supplements.
Mhm.
And more recently, they've shown vitamin D as well, which is playing a very important factor.
Okay.
Omega-3 and vitamin E is in the normal diet, is in the like oily fish, dark leaves like spinach, dark chocolate. Those are sources of omega-3. But for capturing the level that is required for the tear, it means that you need to take lots of oily fish every day. And therefore, it's recommended to get supplements over the counter. You can get omega-3 vitamin E, which is not only useful for the eye, but it would be good for the skin and the cardiac system as well. And I recommend to my patients. And the vitamin D has been shown actually playing very important factor in the dry eye
and for neuropathy.
and the neuropathy, and then
This
for
is our friend Osman Alam's work,
Yeah.
vitamin D, if you can remember,
yes,
from our days.
Yes,
I
yeah.
guess. It's a PhD
Yes.
student. So.
they even now shown that like vitamin D can improve the progression of short-sightedness in children. And but for the dry eye is very lots of new dry eye drops has vitamin D added to that as well.
It works locally.
Yes.
That's good news.
Yeah. And then the other thing is that the hydration is very important to have not 2 liters of water, but at least a full glass of water, and it should be a pure water rather than tea or coffee. And then the other important factor is our lifestyle. For people working in the office or using lots of screen, they call it 20-20-20 rules. Every 20 minutes, we need to close the eye for 20 seconds because that allows the full circulation of the tear. And then therefore the full front of the eye, the cornea, would be hydrated, or looking at object 20 feet away.
Okay.
Which is, we forget, because when you're in front of the screen or using your mobile or your tablet.
20 feet away is 6 meters.
Yes, something a distance that allows the eye muscles will be relaxed, and then you do a full blink rather than a partial blink. When we are staring something, we usually turn to be a not full blink.
Okay, well, this is also new to me.
Yes. And also having the time outside, the sun can cause more, but inside also the air conditioning, and in the car, like air conditioning of the car, all of them are contributing to more
This artificial
significant
atmosphere we're living in is
Yes.
pretty bad.
Yes. And then to improve that part is the artificial tears, that there are lots of them, but majority of them is have a hyaluronic acid or some other, that the level of that is different, and the price comes in a quite massive spectrum. But addressing all of those other before using the eye drop, that would help to solve the problem fundamentally rather than superficially.
Okay, so my take-home message from what you were saying is that diabetes increases the presence of dry eyes.
Yes.
Dry eyes is not a single entity, but rather a group of diseases which can coexist together with one more than the others. And it is the ophthalmologist's job to find out what's wrong. Please see the ophthalmologist. Don't depend on yourself. Let the ophthalmologist examine you, and he can make out which part is the biggest problem, and he can tell you which type of eye drops works best. And Lastly, dry eyes can be a manifestation of nerve damage caused by diabetes or high blood pressure or high blood cholesterol. Okay, and it can also be caused by a series of nutritional deficiencies.
Yes.
So that's basically what we said. What you
Yes.
said. Okay.
Yeah.
Thank you.
Thank you very much.
It's all pretty new to me.
You're welcome. Yes, we can discuss that further if you're interested. Yes.
Thank you so
Thank
much.
you.
Yes,